Industry experts say a 20 to 30% shortage of medical coders is expected to increase to 50% next year. So if you have a thing for medicine and want to work in, let's say, casual attire, this might be the job for you. But you also need to have an analytical mind. You need to be committed to lifelong learning, and you need to be comfortable with and curious about medical terminology. This is what a coder does. They translate a patient's records, the diagnoses and treatments, into codes that are then used by the insurance companies to pay healthcare providers. You need to be accredited, which means taking 700 to 1,000 hours of coursework in areas including physiology and pharmacology. Once you get accredited and acquire some experience, though, you can work at your own pace from your own home.
I get up, I get my kids off to school, and I grab a cup of coffee and I sit at my desk in my pajamas and I code from home all day.
Jill Tracy is transitioning to be a coder after 13 years as a radiation technologist. Along with the job's flexibility, she sees greater career upside as a coder, planning to become a trainer eventually for her current employer, Trust HCS. Trust HCS contracts coders to hospitals like this one, and it's on a hiring spree. It's beefing up its coding ranks ahead of a federally mandated change to the industry standard next October. The number of codes used globally will jump to more than 140,000 from the just over 17,000 used now. This means coders will be less productive, so more are needed to keep up with the paperwork. Even for experienced coders like Julie Davison, it means more training, but then again, that too is part of the job.
You have to be very detail-oriented, and you also have to be able to adapt to change because the medical field is changing on a regular basis, and you just have to be able to go with the flow with that.
Now, coders can earn anywhere from $30,000 to $60,000 a year, but there's good news for them. Because of this shortage, the contract providers are increasing the salaries, and companies, including Cox Health, they are paying retention bonuses to experienced coders because they don't want them leaving this hospital.